When we're calculating Tmax for someone with suspected acute coronary syndromes, we need to tell a computer whether the patient has had vomiting in association with their pain or discomfort. So what does that mean, and why is it in there? Well, the first thing to say is that the vomiting has to occur in association with the chest pain. Now, when we take a history from a patient who's in or who's had pain, there are certain things we need to know. We need to know where the pain was. We need to know how severe it was, how long it's lasted, and the pattern of when it's occurred. We need to know about the pain radiation. We need to know about exacerbating and relieving factors. And we need to know about associated symptoms. So, vomiting is one of the associated symptoms. Now, we're not interested in whether the patient vomited 12 hours before the chest pain. We want to know if they were vomiting with this pain. That's an associated symptom. Now, why is it in there? Well, you may know that it's part of a textbook definition of the symptoms of a myocardial infarction. If you're vomiting, it's supposedly a whole lot more likely that you're having a myocardial infarction. And the evidence backs that up. So if you look at the population with suspected cardiac chest pain using the evidence from when we derived the TMACS decision aid, the baseline probability of an acute myocardial infarction in someone who has a suspicion of that diagnosis is 18 or 19%, or at least it used to be. Now, when we apply a test, we either increase the probability of the diagnosis or we reduce the probability of the diagnosis. So have a think where you think that percentage might go to if the patient has been vomiting in association with the chest pain. Well, it goes up, and it goes up quite significantly to 41%. So that's quite a powerful positive predictor. And that's why it's in the TMACS decision aid. It was also found to give independent information of all of the other predictors like troponin and ECG changes, for example. So that's why it's there. It's a really important positive predictor. And we're looking for vomiting that occurs in association with the pain or discomfort because that makes myocardial infarction a lot more likely.